Hello, everyone. It's John Benko, the Director of Nursing here on the Belfair campus with an April 6th, Monday, COVID-19 update. Took my temperature today, as I always do. It's 98.6, so I'm not febrile, and I certainly have no other symptoms, and I'm happy to report to work today. If you have any symptoms of illness, including a fever above 100 degrees Fahrenheit, we need you to call off. Reach out to your supervisor, follow your call-off protocol, and stay home. We do, of course, assess and monitor the health of all of our residents. We take their temperatures twice a day, and we look and make sure they don't have any symptoms of the COVID-19 virus or any other illness. And today I'm happy to report that none of them do. We did get some new numbers out of the state of Ohio. They are climbing. We're expecting this. We are not seeing anything terribly out of the ordinary. At least statistically, we're seeing that about 25% of those hospitalized are making it to the ICU, and we know that we're only testing the very sick folks at this time. There are some other informations that made its way out today. One is the mortality and morbidity weekly review from the Centers for Disease Control. And this one deals with the pediatric exposure or pediatric involvement, children involved with the COVID-19 virus here in the United States. And as we look at it, we're not seeing any surprises compared to what we've seen around the world. A low incident of involvement. And we're also seeing that those cases when they are symptomatic, do not require hospitalization. So we take some comfort in those numbers. I'll dig through that report a little more and probably have some more to tell you in the days to come. We do want to talk a little bit about PPE. Many of you know over the weekend that you saw some directions, or I should say some guidelines come out from the governor and Dr. Acton as well as the CDC, where they mentioned wearing a cloth face covering when you're out of your house. So as we look and see many of our fellow citizens of the world in the further eastern civilizations will many times wear masks or some sort of covering over their face when they're outside so as to be polite. So if they were to cough or sneeze, they wouldn't infect someone else. This is what they're talking about, a cloth face covering. They are not referring to a surgical mask or an N95 respirator mask. We're reminding you that all of the supply of those masks are going to be needed and in much demand during the surge for our medical professionals at the hospital level. Many of the hospitals are short of those now, so we want to make sure we're not using those up in areas that it wouldn't be appropriate, and for daily use by someone who's non-symptomatic, they would not be appropriate. So it's the cloth face coverings that they're talking about. We have reached out, found some sourcing, and we're working with facilities and, of course, senior leadership to source some of those and have them available for you. So if you want a cloth mask and you can't locate one, we should have some for you probably midweek next week or so. That's about it for the update today. I know it's been a busy day, but it's a nice day. So if you have a chance and you can get out and relieve some stress by walking around, that would be great. If you're having some difficulty with stress, and we know this is a stressful time, please take a moment to reach out and engage in the employee services that we have available for you. You could reach out to HR. They can give you the contact information. Your supervisor can give you the contact information, or you can email me at benkoj@wingspancg. I'd be happy to give you the contact information. Those services are important. We all need to stay healthy. We provide an essential service, and you need to ask for help if you need it. We're happy to get it for you. That's it for the update today. I hope your day went as well as it could. In the meantime, until we have a chance to talk in tomorrow, please wash your hands, be kind, and stop touching each other. Have a great night.